what do they look like in Black communities in the United States? Well, we know that Black people represent 40% of the new HIV diagnoses in this country, but we represent about 14 to 18% of those who have a prescription for PrEP, pre-exposure prophylaxis.
This is 2025. You are referring to HIV in the United States as epidemic. All right, now I'm trying to understand what is so peculiar in the United States that there should be HIV epidemic.
And you think about some of the undertones around how Black women have been treated in this public health space in the name of research, the belief that Black people as a whole, during our enslavement period, that the belief that Black people could not feel pain. I am Leisha McKinley Beach, reside in Atlanta, Georgia. Very happy to be sharing this space with my brother as we talk about something that is near and dear to me, and that is ending new HIV diagnosis, not just in the United States, but around the globe, and a few challenges that have come our way this year. But as a woman of faith, I am a complete believer that we have the power to impact and make the world a better place for ourselves.
I love that. We can make the world a better place. That reminds me now of the music by Michael Jackson.
Yes, heal the world,
Heal the
make it a
world.
better place.
That's so true. I still remember those songs and also those graphics. They were really very powerful, emotional, moving the people to action. I hope they should listen, because if they take action based on what he was saying, things will be different than what we have today.
Yes.
Leisha, tell us something about you growing up. You grew up in New York?
Oh, no, honey. I am a Southern United States girl.
Oh, tell me about growing up in that beautiful place.
Yes, I had a chance as a child to grow up in an area that was extremely rural. And, I got a chance to ride my bike and hear the words of my grandmother to be home before the street lights came on, and you could go out and play all day. Spend time with friends, the long days of sunlight in the summertime. And yeah, I'm just a country girl at heart that is having this urban experience of living in a metropolitan city like Atlanta, and just grateful for both experiences.
All right. Do you want to tell me something about your grandmother? That could be interesting. Okay, now this is why. You see, Obehi Podcast is entirely dedicated to the African diaspora, to the people of African descent that are living outside the continent. We don't care whether you came here today or you came here 200 years ago. we see us as one. We are interested in our story. We are interested in gathering everything we can about the past, not because we want to remain in the past. We want to use it as a kind of the foundation to set up for where we want to go into the future. So yeah, what do you remember of your grandma? Tell me anything you can remember of her.
Oh, absolutely. So my grandmother was a woman of faith. Many people in my community would refer to her as a prayer warrior. And that faith she also passed down to me, that regardless of what is happening in life, know that the Creator will never leave you nor forsake you. And that if you can remember that principle, that there's nothing that you can face that you can't overcome. And I have taken those beliefs and also passed them down to my daughter, who is named after her. Because she meant so much to me, left that legacy of honoring God, working for community, advocating for those things that are right, and know that at the end of the day, the ultimate goal is to hear when life is over, well done, good and faithful servant. And just talking about her now makes me feel her presence in this space. So thank you for asking me about her.
Thank you so much for that. Of course, they are never really gone. They are always around us. That is why
Absolutely.
we are always seeking the assistance of the holy ancestors, those who have departed, but who are actually, okay, not to say dimension, but they are always present. So we sometimes ask for their intercession. We ask for their intervention. Sometimes when the things become too hard for us, we cannot take it anymore, or it becomes overbearing, we ask for help because we believe that we are not alone. We believe that we are never left alone. We believe that help is going to come. Yeah,
Yes.
that's good. I love that.
Thank you.
So, of this community that you grew up in, was there anything particular of the time that you were growing up? Because I am interested in you of forming yourself. What is framing your reference at this time?
Well, I mean, growing up in a rural community, there were some life lessons that has served me well in this point of my journey as an advocate in public health for Black people. Seeing how um, Black women would organize, even if it was for church events. There's this intensity about operating in a spirit of excellence. And that I did not learn in an academic institution. I learned from watching the elders within my community and how they would serve in that spirit of excellence for um, community events and supporting those who were in bereavement, and understanding that even if they were never acknowledged, that this was a part of who we are, in supporting and uplifting one another, because we didn't get here by ourselves. And that unity, unfortunately, that I have seen, um, slip away from decade to decade still resonates with me, that people who had so little that did so much to support one another, that they left that type of playbook, that strategy for us to employ. And seeing where we are in the world in 2025 says we have to get back to some of those key strategies that that they implemented, because they're necessary for our survival.
Thank you so much. Thank you very much for that, Leisha. So you are a public health advocate for Black people, right?
Yes.
Okay. Could you give us a kind of what we could say the outlook, the picture? What is the situation of public health among Black people in your area or in the United States, whichever way you want to look at it?
Sure. So this has been an interesting time, just reflecting over the history of public health and its relationship to Black communities. That there are people around the world who are familiar with a government study that was done in a southern state, Alabama, within a predominantly Black city of Alabama called Tuskegee.
The famous Tuskegee.
Yes, and I raise it and I share it in this way because this is my way, this is my contribution of eliminating the stigma that's associated with Tuskegee, Alabama. This wasn't the Tuskegee syphilis study. This was a federal government study that happened in Tuskegee, Alabama. And I lay the foundation about public health in Black communities there because it's in this moment that we see where medical mistrust becomes so ingrained within Black populations, and that it is now impacting the health outcomes of Black people in the United States, because this country has given us reasons not to trust the healthcare system. But here's some good news, that there are trusted individuals within our community that bear the name of doctors and clinicians and nurses and social workers and all of those that make up that healthcare system that people do trust. And as a part of that, they are helping to lead this charge in better health outcomes among Black Americans in the United States. If we fast forward to this year alone, how the administration is impacting those health outcomes, not just for the United States, but they're impacting the health outcomes around the globe, is heartbreaking. It's a travesty. And this is a time when it is so necessary to see Black leadership, as you have referenced across the diaspora, come together to support each other as we continue to support our communities for better health.
Thank you so much for that. Now, is there any particular case in reference to what you were referring to there, of maybe what the government is doing that is bringing about distrust, even though there is actually people that need to be trusted in the name of nurses, doctors, those who are putting their life on the line, like you said. But in this case, now we have the institution or the system that have given room for the African diaspora people or the African American to distrust this particular system. Is there any uh, particular case that you can share in line with that?
Sure. I mean, there's several things that we could look at both domestically in terms of the United States, and then what's actually happening globally as well. And so there isn't um, a country or an area on the globe that wasn't impacted by COVID. And what we have seen what we saw during the COVID epidemic is all of those social determinants of health rear their ugly heads, such as poverty, such as lack of education, such as the granddaddy of them all, racism. And it shows up in service delivery, it shows up in the promotion of prevention strategies, it showed up in who got a chance to shelter in place at home and who had to be on the front line, putting their lives at risk every day so that they could still feed their families, uh, as it, related to their livelihood. And when we're not addressing those things, um, we're not getting to the root causes that put so many Black Americans at risk, not only from contracting COVID, but dying from it. And so we see some racist practices even in the healthcare system for how folks were determined to be eligible for different treatments, respirators, services, all of those things. We see how some of the messaging for gatherings, such as in Southern United States, church is a big deal for many Black communities. Our place where we gather, that's our place of worship. And how information was shared about, let's look at some alternatives to in-person worship, wasn't always culturally relevant. And so we saw where there were outbreaks in churches, even within the United States. When you fast forward to part of our discussion for today, where we see an administration that has such disregard for many of the global aid and public health programs, one of which is known as PEPFAR, which was which is a global program to help those impacted by HIV. And at the stroke of a pen has sent this program into chaos about what we can provide, what people within those countries can provide, and what is now either going away or will be delayed in providing those services. That's why you mistrust. That's why there's such great distrust in, is there truly a care for humanity? Period. Because if we care about living, breathing human beings, then we're going to do right by them in their health care.
There is a lot there. There is a lot there. We are trying to remind the government to care for the people. They know this. They should know this. They should have known this. This is why they were voted into office and offices to protect at least the most vulnerable member of the community, of the society, the citizens, people who are carrying the passport, people who are working to contribute to the task that is needed to run the country. Nobody should ask a parent, take care of your children. It should be natural. So now we are reminded them, protect your people. You also made mention of, you call it the granddaddy of all, racism. Somebody will say, are you still talking about it? We should have forgotten it. Can't we just forget about it and move on? I've said it a number of times. Yes, it's easy for you to say, except maybe you are not at the receiving end. If you are at the receiving end, it is impossible to ignore. All right, now, have you seen any change in it? Has there been improvement? Because this is the country you were born and you grew up there, you probably have seen it before now. Yes, you have seen it before now because we know the story of the United States. And it's quite horrible sometimes. Of course, the country have done a lot of good things. I'm not denying that, but they have also done a lot of horrible things, especially in this a world champion in discrimination and racism and quote unquote systemic racism. Now, have you seen improvement, a kind of consistent improvement to eradicate it? So that today, now we have new administration of Donald Trump, we can say maybe things are moving better, or is it worse? What do you say of that?
I actually see a lot. I see a lot of amazing things happening on the front of ending new HIV diagnoses in Black communities across the globe. I also see some great strides, things that will have to change to help us cross that finish line. But I want to start with the good news first. And the good news is we have had such extraordinary advances in science that have provided us with tools to help us get a little bit closer to ending new HIV diagnoses. What we now know in terms of people who are living with HIV, that when they get into treatment and when they have access to their medications and they are able to take those medications, they get to an area where we call viral suppression. And what viral suppression means is that the virus itself is not taking over the body. There are actually fewer and fewer copies of HIV within the blood of people who are diagnosed with HIV. And so because there's so little of it, they're not transmitting HIV to their sexual partners. That's huge. That's a game changer for us in the HIV movement. And then we now have medications to prevent those who are not diagnosed with HIV from ever becoming diagnosed with HIV. And when you couple those two together, we are talking about an extraordinary movement to declare victory over HIV. But here's the challenge. The communities that need and can benefit from these medications and models the most are not getting full access to what they need. And this isn't just internationally, this is also right here in the United States. And so when we began to look at different populations, even in the United States, in terms of HIV, we see where white men are literally at the finish line. I would not be surprised if there wasn't a news story or headline 5 years from now that says that there has been a trend of seeing less than 5% new HIV cases among white men. And don't get me wrong, that is grounds to celebrate, because then we'll know that it is possible that it can happen. But it will also reveal to us why it has not happened within Black communities around the world. And it's all those other challenges that we can link back to the granddaddy of them all, and that's racism.
Hmm. All right, now let's look at the data. Data become very important now. Looking at the African diaspora community, they gave the African Americans and the European Americans, the white people, so-called in this case.
Mm-hmm.
What is the percentage of the people of African descent that are suffering from HIV in ratios to the population and to the Europeans, American?
So excellent question. Especially today as we observe National Black HIV/AIDS Awareness Day, to raise folks' awareness about how HIV is still impacting Black communities. So what we know in terms of the data, Black people represent 13% of the United States population, but we represent 40% of the HIV epidemic. 13% of the population, but 40% of the HIV epidemic. And when we begin to talk about those amazing tools that I just referenced, what do they look like in Black communities in the United States? Well, we know that Black people represent 40% of the new HIV diagnoses in this country, but we represent about 14 to 18% of those who have a prescription for PrEP, pre-exposure prophylaxis, that medication that I referenced that is preventing people who do not have HIV from getting it. So we don't get closer to ending those new diagnoses in Black communities if only 14, 15% of the people who look like me have a prescription. We need to be talking about the equity of about 90% of white men who can benefit from PrEP. They have a prescription, compared to 14, 15% of Black people. There's something wrong with this picture. And we have to talk about why those numbers are so low. And some of it is about awareness, that there are Black people who don't even know that PrEP exists in the United States. They don't know that this type of treatment is available. They don't have access to it for those who do know. And part of that access is about um, having the funding or resources available to do the labs, to pay the co-pays, even if the medication itself might be free, there are other costs that are associated with that. And then the third thing that is also significant about this is the connection to how this model, this strategy can be of value within our community. And for that, I will say the public health system as a whole has done a poor job in uplifting that and making that connection, helping us to make that connection for ourselves within our community. And clinical staff, oftentimes who don't look like us, are not even bringing up the conversation to let people know that it's available, even when they're coming in for sexual health services. That's just unacceptable.
All right, Leisha, you're going to help me with this education. This is 2025. You are referring to HIV in the United States as epidemic. All right, now I'm trying to understand what is so peculiar in the United States that there should be HIV epidemic. Why are we not having the same? Why we not say the same about the Chinese, the Koreans, the Saudis, the Israelis? Why we not say the same about the Iranians? Why is the United States singled out and a few other countries in Africa, like South Africa, which again is like the United States, in that there is a clear dichotomy between white and black people, and of course some African countries that are almost used as an experiment. So I'm trying to understand, why is the United States suffering epidemic of HIV?
Great question. And let me preference with um, I do not have the international experience to compare the epidemic of HIV within the United States with other countries. I can only share what I hear from my colleagues around the world. There is a particular organization that I have adopted, and they've adopted me in Ghana, called Acts Ghana, and we connected on the fact that they are using every resource that they have to address HIV among women and girls in their country. And I am using every resource that I have to address HIV among Black women and girls in the United States. And so there, that's how our paths cross. But even if we took, let's start with a subpopulation within Black communities. Let's start with women and girls. And so when we look at HIV in the United States, women represent approximately 20% of the HIV epidemic. And in other countries, we see women who represent far more. And so what I'm told, that in Ghana, women actually represent the largest percentage of new HIV cases in their country. But when we drill down even further, out of that 20% of women representing HIV, when we look at it by race, Black women represent 60% of all of the cases among women in the United States. And so you see that disproportionate impact. So if you have a pie and you cut that pie into 100 pieces, you would have to take 60 pieces of it out. And that represents that gap there of Black women compared to the overall cases among women. That's why I say we cannot address and show promise and move forward with getting to the end of new HIV diagnosis for women if we are not addressing racism that got us here in the first place. And you think about some of the undertones around how Black women have been treated in this public health space in the name of research, the belief that Black people as a whole during our enslavement period, that the belief that Black people could not feel pain. So to be a part of these research studies because we were property owned by some of these medical institutions and different experiments and studies being performed on us with no pain medication, all in the name of science. A lot of those beliefs have still been modernized in how the U.S. public health system provides services. Black people are less likely to get pain medication because of the illusion that we're drug addicts, and that's why we need the pain medication instead of looking at an overall assessment to determine what our pain is like. Black people are more likely to die from complications from surgeries because when we're saying something doesn't feel right or I'm not feeling like myself after surgery, those messages are often ignored. A very public example is when Serena Williams had her daughter, and she kept saying, "I know my body. I'm not feeling like myself." And someone of her celebrity status and wealth is ignored. And she continued to become her own health advocate. And lo and behold, she was correct as she was experiencing blood clots. And so what that says to us is it's not even just about the socioeconomic status. It is also about the glaring difference as we look at race in this country. And now, how does that translate to HIV among women? What it's saying in the United States is oftentimes we are not offered HIV testing when we visit our healthcare providers. There aren't conversations about what's available to us. There are some misnomers that if you identify as a heterosexual woman whose marital status is married, you don't need any of those services. So they're not talked about. There are a whole host of issues that continue to put Black women in a place where we have to be educated and advocate for ourselves.
Okay, thank you for that. Now, the data again. Is it possible that those who are in charge of analyzing the data are not aware of the data, of the incoherence of the data, or is it just fine like that? In that, this is what I mean. If in a population that you have less than 20% of a certain demographic representing 40% of an infection, that is not a good data. Something must be wrong there. Somebody must be concerned in the sense that if you continue like that, mathematically, that can entirely wipe out that population. I mean, wipe out that demography if HIV is a disease that can kill people, for example. I'm just using data now. Somebody should sort of say something is wrong here in this data.
Yes. So, first off, let me just say, and I know that you are aware of this, that as Black people across the diaspora, we are um, extremely intelligent and knowledgeable and strategic in how we raise awareness and provide education in our own community. And so I wanna uplift that. And the fact that we don't have sex different than anybody else. And believe it or not, that there have been some researchers that have tried to go down that path to justify the numbers that we are referencing. And when I think of stupidity, those are the folks that, come to mind for me. But let's break down some of that data. And in the fact that everything that we have talked about for the past 45 minutes, and I have continued to address how racism is the root cause of many of the health outcomes that we are addressing right now. Um, Takes us back to the data and those numbers and what it is saying. And um, many of the uh, data sets that we use in HIV do show one thing that you reference, and it shows that Black people are tested at higher rates than other racial groups. I see that. I see that as an opportunity to celebrate the fact that if more Black people are being tested, more Black people are going to learn their HIV status, and it gives us an opportunity to start planning what type of HIV services do I need to gain access to? Is it HIV care and treatment? Is it HIV prevention? And whatever those services are, that we now gain access to them. And so to see data that shows that Black people in the United States are tested at higher rates, for me, is saying that all of these Black organizations and advocates and coalitions and movements are doing a great job in raising awareness, where the data should be supporting resources and investments to say, wait a minute, what is it that we are seeing within the HIV focus among women? why is it that we are seeing such high rates of HIV among Black women compared to other women within this category? And those reasons are, one, lack of awareness and education. We've done a great job, but we still have a ways to go. Two, a lack of access, ensuring that folks have access to prevention, care, and treatment where they live, work, play, and worship. And number three, looking at all of those systems that are contributing to these determinants of health, that you cannot be talking about HIV's impact and not be talking about poverty. You cannot be talking about HIV's impact and not be talking about other environmental issues that we see Black people also lead the categories in. We cannot be talking about these numbers and not be talking about other health issues that Black people lead. When we look at Black women, we're also talking about Black women who are dying at rates from breast cancer in this country, higher than other racial groups, and yet we do not represent the majority of breast cancer diagnoses. So you see what I'm saying? So there's all these things that are impacting the data. Do I believe that we can, as Black leaders, also have an impact in that? Absolutely. But we have to have a collective movement that talks about the resources, that talks about the information, and that talks about our own strategies that include culture in helping us to end new HIV diagnosis. I'm a believer in that.
Thank you so much for that. You need to keep that belief. Is important. You see, you actually talk about belief at the beginning of the episode, so it's good to keep the faith. Talking of the faith, what do you really want to change? Say 2 or 3 key things you would like to change with your advocacy.
I would say the first thing would be dismantling these infrastructures and systems that are rooted in racism that continue to impact health outcomes for Black people. And they don't just impact Black people in the US, they are impacting Black people around the world. The second thing would be is integrating designs of healthcare designs that include culture, include our belief systems, include the way that as a people that we have been taught, been educated, how we pass down information, even through storytelling. All those things need to be a part of whatever healthcare structure that is implemented for Black communities. And then finally, to be free from any barriers that are preventing us from getting to the best health outcomes for our community globally. And to be free from that means we are addressing poverty. We are addressing police brutality. We are addressing all the isms that impact Black communities to get us to a place where we live not just to the life expectancy, but we are living even beyond that, because we have access to everything we need to make it happen.
Thank you so much for that. That is really a laudable goal, initiative that need to be supported. I want to thank you for that, really.
Thank you.
All right. Now, so if you were to identify some key obstacles out there that are standing on your way, what do you think they are? How can we fix them?
Well, I think the greatest obstacle that we're facing right now, obviously, is the administration within the United States. And how we fix it is not going to be a sprint, but it is a marathon. And that is exercising our right to vote. We have to look at the impact of utilizing your voting right to get people in positions that understand the cultural and lived experience of Black people that can help with the stroke of a pen, create some of these models that we have talked about on today. And so voting becomes key wherever we are, to use that voice to make it happen.
Voting can help to make that voice change or to use the vote as an instrument to change the situation. I love that. I would like to ask you this. For how long have you been on this mission? And what have you seen change along the way?
So I actually started my work in HIV when I was 17, as a peer educator at my university. And this year I will be 52. So
Congratulations.
however many years that is. So, I mean, I have grown up in this HIV movement. And as a part of that, I have seen the highs and lows. I have seen when we were standing by the bedsides of far too many people who were transitioning, who passed away because we didn't have the resources, we didn't have the science and the advancements that we have today. And I have seen those advancements come, and I have celebrated them because they are long overdue. But I have also seen the communities that can benefit from them the most not have access to them.
Now, somebody who have listened to this part of the conversation is impressed by you, love what you're doing, and they want to connect with you. So what is the best way to reach out to you? Share with them.
Sure, that they can reach me on all my social media, at Leisha McKinley Beach, Facebook, and Instagram and LinkedIn. Of course, LinkedIn is where you and I connect. That's where I post. Yes, absolutely. It is where I post most of our just kind of academic and community information to remain in the know about what I'm doing, what I'm seeing, and my opinion about what I see as it relates to HIV in Black communities. So that's the best way. There's still some dinosaurs out there like me who use email. And you can email me, my full name, Leisha McKinley Beach at gmail.com. But trust me that if you connect with me, I will respond.
Thank you so much for that. I appreciate the good work that you are doing, sister. I really appreciate it. We need more people like you who are dedicated their time at the service of the community. This is not an easy work. Putting your time out there is not an easy one, but it is important. It's a good work.
Well, thank you. And it's also important for people like you who have access to platforms where people trust you because they tune in and they listen to carry stories, and sometimes stories that aren't as popular, such as talking about HIV. And so I commend you for being that vehicle for our global community.
Thank you, Leisha. Now, what would be your final thought here to conclude the conversation? Maybe your final message, maybe something you wanted to say I did not ask you. Please go ahead and share that.
Yeah, so I mean, today, like I said, is National Black HIV/AIDS Awareness Day. And even though it is a United States observance, it is a time for us to reflect globally on the impact that HIV has had on Black communities, how we can support each other. It is so necessary now more than ever that we're looking at the end of new HIV diagnosis, not just in the United States, but across the globe.
All right. Thank you so much for that. That message is driven home. I appreciate it so much.
Thank you.